Welcome to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas. And today we've got some great news about an exciting new development here in the state of Georgia.
This is the beginning of a two-part series on public health in the state of Georgia. And we're going to kick off by talking about the development of the new State Department of Public Health.
This created an independent, cabinet-level Department of Public Health here in the state of Georgia.
On May 13th, 2011 of this year, Governor Nathan Deal signed into law HB 214, and this created our new Department of Public Health.
Well, this is a great achievement for the Georgia Public Health Association, for the legislators, the governor, really for the whole state.
This is really timely news too, Cham, because I got to tell you, Georgia consistently ranks very low when it comes to our overall health. Just as an example, in 2008, we ranked 41st of all of the states. In 2009, we ranked 43rd. And in 2010, our rankings went up a little bit, but we still are the second highest state for obesity in kids.
Well, that just goes to show that consistency is not always a good thing.
It's definitely not a good thing. And these rankings that are developed for all the states across the country are based on things like social determinants of health and our health outcomes.
Social determinants of health are those factors that combine together to determine the overall health status, or simply put, the combination of things that influence whether you're healthy or unhealthy.
So here in Georgia, it includes things like our social environment. It also includes how economically viable we are as a state, and it includes what we do in our individual behavior, like smoking.
On the other hand, now these health outcomes that refers to how healthy an individual or a community is.
And it includes things like how long people live, so life expectancy, and also how well do we feel.
So, according to these rankings, no matter what you look at, Georgia's not doing well in any of these measures.
That's exactly right, Cham, and that's why the creation of this new State Department of Public Health is such a wonderful thing for us.
To give us the inside scoop on the development of this new department, we're going to have several key players that help bring this about.
Together, all of these guests will paint a picture of how the creation of and formation of the new Department of Public Health came into being.
Like I said at the beginning of this segment, this is a very exciting and very significant development, so please stay tuned.
I have with me now Dr. Phil Williams, who's the Dean of the College of Public Health here at the University of Georgia, and he also served as the Chair of Georgia's Public Health Commission, and he's here to tell us a little bit about that experience. Welcome.
Thank you, Phaedra.
So my first question for you is, why the development of this Public Health Commission?
Well, I think the state legislature was concerned about the area of public health within the state of Georgia, and so they mandated that a commission be formed to study the organization of public health within Georgia and where it should answer within state government.
And who was on the commission?
There were 9 members, 5 appointed by the governor, 2 by the lieutenant governor, and 2 by the Speaker of the House, and it represented a cross-section of Georgia, both geographically as well as professionally. Most had some background in the area of health or health care, but they also included an individual from the banking industry and some other non-health related areas.
Sounds like a nice cross-section. What was the charge of the commission?
The charge was to look at how public health is organized within state government and to consider 4 options. 1, to leave it the way it is and not to change it. 2, to move it within its current organization at that time, Department of Community Health, and have it answer to the Commissioner of Department of Community Health in a different manner. Or to move it to a different department within the state, being number 3. Or 4, to organize a new Department of Public Health that answered directly to the governor.
And as chair of the commission, what was the overall process?
We heard testimony from July of 2010 through the end of the calendar year. We had monthly meetings, heard testimony from a variety of people from within state government, from the state legislature, from universities, from the general public. We had it open for comments to be made over the internet or for them to show up and give testimony to us.
And did you hear any general themes that were coming from the people who were testifying?
Yes, there were 2 common statements made. 1, the state of Georgia doesn't do a very good job in the area of public health. And 2, there was a common belief that if it was organized differently, if it was organized in such a way that it had more visibility and more responsibility, that being an independent department answering directly to the governor, that it would be better positioned to serve the needs of the state of Georgia.
It sounds like you had a lot of hard work on this commission, lots of good testimony. What were your final recommendations?
The unanimous opinion of the 9-member commission was that the state of Georgia should establish a Department of Public Health that was directed by a commissioner that answered directly to the governor.
So I understand that this commissioner's role now of the new Department of Public Health is to interface directly with Georgian citizens. How important is that role, and how will it be achieved?
Well, it's very important because public health affects all Georgians, and it affects our economic viability. It affects everything about what we do in the state, and it also affects the people who visit our state. And so it needs to have someone who has a responsibility to interact directly with the governor, to be a policymaker at the highest levels, and to be able to address the state's needs. And that can only be done by having it as a cabinet level position answering directly to the governor.
We're now being joined by Representative Mickey Chanel from District 116. Thank you so much for joining us today.
You're welcome.
We're talking about the new Department of Public Health, and before we get into some of those questions, I just want to know, District 116, who does that represent?
Putnam County, Greene County, Overthorpe County, and Wilkes County.
Okay, and how long have you been representing that district?
I'm coming up on my 20th year now.
Wow, that's great service to the state. Thank you for that. Since you've been in service for so many years, what did the public health system in Georgia look like in the past relative to where we're going in the future?
Well, it really goes back to the 70s. I wasn't there in the 70s, but when Governor Carter reorganized state government and he created an umbrella department that took into account most all of the healthcare services at the state level. And so over time, that department kept growing and growing and growing and became more and more difficult to manage, quite frankly, because it had so many different functions. I remember one budget cycle they brought in a 200-page notebook that had all of the different things they were trying to do under that one umbrella. And it became increasingly apparent that department needed downsizing and more direct focus on what the different parts of that department did.
And so when did the legislature start thinking about making changes to the infrastructure?
It was actually in 2010. Last year, there was a bill that had the effect of downsizing that department in a big-time way, and we were able to get that done last year. It did not include the Department of Public Health, or that is to say it did, but it didn't make it a standalone agency.
So it was the creation of 3 new departments out of the 2010 legislation, is that right?
That is correct. It was the Department of Behavioral Health and Developmental Disabilities. Public Health moved over to DCH, and the third one was the Department of Human Services.
Okay, so we heard from Dean Williams about the commission, this commission that was tasked with coming up with new design plans for the public health. How did that play into this infrastructure change?
Part of the bill that downsized that department, which was last year, part of that bill included language that called for the creation of a commission to look at how is this working. That is to say, how is it working that public health is in the Department of DCH, and what changes they would recommend, if any, to the structure of the department.
And we know that their recommendation was to create a separate Department of Public Health. And did you actually introduce House Bill 214 that created the new department?
I did, yes.
Who were some of the key players you had to have involved to make this all happen?
Well, again, obviously the governor played a big role. He was one of the first ones I went to in terms of language and how the bill was developed. Our governor, the Governor Deal, has a long background in health care. He understands health care, and he was very enthusiastic about this whole notion. And of course, our colleagues in the Senate as well, plus the leadership in the House.
And how do you think this new Department of Public Health will impact your constituents, or maybe even across the state?
Well, again, you have to contrast it where it was and where it is now. And that is that it was part of a big, huge umbrella agency. Now it's got its own commissioner who directly reports to the governor. It will be much more focused. I think the outcomes will be better. I know the morale in the department is much better already because of all that. And I think at the end of the day, I think the citizens of Georgia can expect better outcomes, better results from their Department of Public Health.
Well, I want to thank you so much for joining us today, and again, just to thank you for your service to the state of Georgia.
You're quite welcome. Thank you for having me.
Continuing with our topic of the creation of the new Department of Public Health, we're now being joined by Senator Renee Unterman, who's from District 45 in
Gwinnett County.
Gwinnett County. Thank you so much for being here today.
Thank you for having me.
I'd love to hear about your role in getting this legislation passed on the Senate side.
Well, I did carry the legislation on the Senate side, but I have actually been working on this issue for about 5 years now. Some people think that you just have an issue and in 3 months in one session it passes, but that's not in actuality how it happens.
Well, you have a clinical background in nursing and social work, and so I think you have a unique perspective on what the department should do next. And thinking about this new Department of Public Health, and particularly the new commissioner, what's next?
Well, I think we chose a good commissioner, Brenda Fitzgerald. She's an OBGYN, she's a physician. One of the things that we want to focus on is immunizations. Georgia had done very well with immunizations, but now we're continuing to fall behind, unfortunately. Obesity, not only in adults but in children, is a big issue. There are many, many issues, public health, that are critical for the state to move forward.
And so some of the immediate challenges for, not just for the department, but the whole public health infrastructure, what would they be?
You know, you're a new standalone department, and here we are right in the middle of a recession, and you're trying to start a new department. So you're competing with transportation and other big infrastructure issues. The University of Georgia, the Board of Regents, I mean, everyone wants money, so it's going to be difficult. But the good thing is legislators understand that health care is a key concern, and they know that they have to take care of business.
And how about some of the longer-term challenges that the commissioner or the department will have to face?
Well, one of the things that we have focused on and want to change is the grant and aid formula. Georgia has transitioned from an agricultural-based, and the legislators were all from the agriculture, and they were concerned about that. And now we're a metro urbanized community, and we need to change our monetary focus of how we hand down the money to be able to take care of specific diseases.
Okay, my last question for you is to try to make this more real. We've talked a lot in this show about the legislature and all this that's happening far above the people on the street. So bring us back down to your district, and what are some real ways that the public health is impacted, or the infrastructure or the system is impacted by what's happening with your constituents?
I'm glad you asked that question, because I have my constituents and actually business people call me in my particular county, in Gwinnett County, where we had an outbreak of tuberculosis. And we actually had people who didn't want to go to the grocery store because they were afraid to touch the grocery cart. So the business people, the big chain stores, had to start implementing and putting in a way to wipe down the carts and to protect their employees from the tuberculosis. And I said to the governor and to my fellow colleagues, you know, what is happening in the state of Georgia where we're concerned about tuberculosis, we're concerned about pandemics and things like that, but, you know, how do you take care of those? How do you prevent those from happening? We're one of the most successful states in the nation, but here we are having a tuberculosis outbreak. So that grant and aid formula has got to be changed. It's got to be distributed more fairly and equitably to take care of our changing society.
Well, thank you so much for that example, and more importantly, thank you for your service, 22 years already to the state of Georgia. It really means a lot to us as citizens, so thank you so much.
Thank you.
We're now on location at 2 Peachtree Street, the home of the new Department of Public Health, and I'm here with Dr. Brenda Fitzgerald, who's our new commissioner.
Welcome. We're so glad you're here.
Thank you. My first question for you, this whole show has been about the creation of this new Department of Public Health, so please tell me a little bit about what are the functions of the Department of Public Health?
The functions of public health really have to do with protecting the lives of the people of Georgia. We do that acutely if there is an epidemic of some sort, or if there is a disaster, either natural like a hurricane or man-made like bioterrorism. We do it long-term like with immunization programs and health programs for such things as how to tackle obesity. And we do it day-to-day. We inspect food, we inspect water in swimming pools, restaurants, that sort of thing.
And you're your own department now, which is a little bit different structure than we've had in the past. What are some of the benefits of being your own department?
I think the real benefit is that we are more flexible now and more agile. Public health has to respond quickly, and being in a super agency was a little prohibitive in that manner. So I think we'll be a lot more efficient and a lot more effective as a separate department.
And do you still have any type of relationship with the Department of Community Health from where you came?
Oh, absolutely. Community health was, they were great to us when we were separating out and sending up the new department, and we continued to collaborate with them. For example, if you are looking at infant mortality like we're looking at right now, one of the things that you can do to make sure that you have better birth outcomes is to make sure spacing of children is important. And community health just has a new waiver, for example, for birth control to help space pregnancies on at-risk mothers with at-risk children.
And what is the governance structure of the new department?
We report directly to the governor. I am appointed by the governor to be the commissioner of this department. And we have a board that's an advisory board with whom we discuss policy and we bring up various issues that need to be handled in public health.
Can you tell us who's on the board?
Certainly, and I'm very excited about the governor's choices. We have representatives from the National Guard, from Georgia National Guard, and that's important because, of course, we do emergency preparedness. We have people from academics, like Dr. Williams from the University of Georgia. We have people from the private sector. We have a representative from Southern Company. We have a representative from a nonprofit that's very involved in public health work, and we have practitioners. We have a dentist, we have a neonatologist, an epidemiologist. So I'm very pleased. I think we have both practical experience and academic experience. I'm very excited about the board.
My last question for you is, you're a new director of a new department. What are some of your goals, personal goals, professional goals with this new department over the next couple of years?
I believe that in the super agencies, public health wasn't able to do as much as it can do. And my goals are to make sure that public health realizes its full potential. There are some wonderful people here, and I think we're going to do some good things.
Great. Thank you so much.
Thank you.
We're now going to talk about public health at the district level. And I'm with Dr. David Westfall, who is the District Health Director in District Number 2. Thank you so much for joining us.
Sure, it's my pleasure.
My first question for you is, where is District 2? And tell me a little bit about the population you serve.
Sure. District 2 is actually located in northeast Georgia. It's 13 counties that border on the north, the North Carolina border, and on the east, the South Carolina border. That's Stevens County, Hart County, Franklin County over on the eastern side, and Union County, Lumpkin County, Dawson County on the west side. 13 counties in all, and Hall County is what's referred to as the lead county, largest county, and that's where the district office is located. Our population throughout the 13 counties is probably right around 500,000.
And what do you see, we're in this show, we're talking about the new Department of Public Health at the state level. What do you see as the value of the new department?
You know, if you've looked at the health rankings of Georgia over the last few years, you've noticed that we're consistently in the bottom. And I think the fact that we have now decided to have a separate Department of Public Health focuses on the importance of health to the people of Georgia. It also gives us more of a direct ear to the governor, and that the commissioner, Dr. Fitzgerald, reports to him, and it allows the governor to be more actively involved in promoting health in the state. So I think those are big advantages.
And do you see the day-to-day operations at the district level being impacted by the new structure at the state level?
In some ways, yes. In some ways, no. And what I mean by that is that at the district level, we are responsible for managing the public health that's in the 13 counties, and that will continue to be the same. We probably won't have much of a change in that. I think the biggest change is that we know that we have a strong advocate now in Atlanta and with the governor who can advocate for additional funding when we need it, who can be sure that the technical assistance that we get from the Department of Public Health at the state level is correct and of good quality. So I think that we have a better infrastructure now to support what we do at the district level.
So one of the things I'm trying to get a handle on is the core functions of public health. We know there's core functions that need to be taken care of, like immunizations as an example. Can you tell me a little bit about what specifically are the services provided at the district level that you're responsible for,
Sure.
and how might that differ across the districts?
Sure. The way that we're structured in Georgia is with the district system. There are 18 health districts, as you probably already know, 159 counties. But we're structured that way in order to provide some administrative efficiency. Most of our local health departments are in very small counties with limited staff, and in order to be able to have the type of administration, the type of infrastructure and support that they need, we're in a district structure, and we provide centralized support for administration, for human resources, for information technology, emergency preparedness planning, all those sorts of things. The district health director is responsible for the delivery of all public health services in his or her district, so in my case the 13 counties, and we are also responsible 24/7 for emergency preparedness issues that may come up. We have about 50 different what are called multi-county programs too that are operated at the district level, but which provide services to people from any of the 13 counties.
Okay, so give me an example of some of the services of those programs that you're talking about.
Things like the TB program that we have at the district, epidemiology, the Babies Can't Wait, Children with Special Needs, some of the women's health programs, those services.
And they serve all the counties within your district?
That's correct. They support all of those counties. They have separate budgets. We have categorical budgeting that comes that only can provide support for that particular program, but they then support all of the local health departments in those areas. And so we manage that all from a centralized area of the district.
And is that how most of the districts are operating in the state, or do you see that there's different governance structures or services being provided depending upon what district we're talking about?
To some extent there are differences. The basics are pretty much the same. But for instance, in the metro counties, you have districts that just have a single county. And so their administrative structure is going to be different than, for instance, in my district, District 2, where we're supporting 13 counties, 13 separate health departments, and about 350 employees. Another thing that's going to vary somewhat is the particular type of extra services that may be provided, and that's really based on the availability of services in a community. A good example of that is in Hall County. The Hall County Health Department provides prenatal care, obstetrical care, which is not typical for public health in Georgia. There are only a few of the districts and a few counties where we provide obstetrical care.
I was going to say, what is the reason that
reason for that is a community need that's not being met otherwise. We try to kind of fill in the gaps, if you will. One of the responsibilities of public health is to assess the health services that are needed in a community and then try to facilitate the provision of those services. Ideally, those services would be being met by providers in the private sector or other agencies, but when they're not, then public health has to use whatever resources it has to try to step in and fill that gap.
So for prenatal care, is it the case that there's just a large number in your population who don't have health insurance, and that's why they're not able to get prenatal care, or?
This is primarily Hall County. That's where the prenatal clinic is located, and we've had a large Hispanic community in Hall County, 25% of the population at one point. Wow. And a number of these people are undocumented, but they need care, and they're not eligible for Medicaid, they're not eligible for any other funding source, and so we have a collaboration with Northeast Georgia Medical Center, the Longstreet Clinic, which is a private multi-specialty group that has an OB department, and we actually provide the care at the health department with assistance from the Longstreet Clinic in Northeast Georgia Medical Center. It's a great example of the type of collaboration that we have to do, because none of us has the resources to meet all the needs.
Right.
So we're trying to meet the needs of the particular counties based on the other resources that are there. And we try to look at what might happen with natural disasters, with infectious disease, bioterrorism, all of those sorts of things, and figure out how in the world we can together meet those challenges.
Well, thank you so much for your time today.
Sure, thanks for having me.
Today's show was a very revealing one. With this new creation of a Department of Public Health at the state level, it shows that health is now a key priority for the state of Georgia.
And we saw how seriously now this is being taken. This is a serious issue, and now we're moving forward to do something about it.
So of course, Cham, improving our health rankings, like we discussed in the beginning of the show, is not going to be an easy task, but the fact that they created this new department shows that at least they recognize that this is not an easy task, but they're ready to take it on. So thank you for being with us today on PHI Public Health Impact, and join us on our next show where we explore more about public health in Georgia, in particular the coordinated effort at all levels of government in improving our health in the state.